Hi all at FIA, this is student Nick Blackwell, number 150149094. I'm here with Kate this evening and we are going to do screening 2 or case study 2. So firstly, welcome.
Thank you.
Hope you're going well tonight. We're just going to quickly run you through this screening so you have an idea of what's going on. It's going to be a multi-stage screening. First 2 components will be physical, the last component will be written. I think we start off easiest here with essentially our body composition analysis. What that involves is basically just your height and weight and what kind of insight we can get in from your body and what kind of makeup you have at this point in time. From there we'll go on to a passive postural analysis. So I'll look at essentially how you stand, is everything aligned, are there any kind of indicators of potential postural abnormalities or defects.
Yeah.
And then second to last, we'll go on to a dynamic analysis where I'll get you to perform a movement. In this case, it's going to be a bar overhead squat.
Yeah.
And so what will happen, I'll get you to grip a bar, or in this case a broom handle, in a certain way, just to alleviate the weight, and then perform a squat from there. With that in mind and all the postural analysis that I've done previously, we'll try and see if there's any limitations to your movement patterns, and so whether or not any action needs to be taken from there.
Yeah, that'd be good.
Lastly, we're going to go through essentially a food diary and then a goal setting kind of mindset phase to kind of flesh out what we want, what we can change and what we need to do.
Yep, that sounds good.
And so first of all, the scales, if you wouldn't mind stepping onto those, that would be great. So from here, you can see you weigh 61.9 kilograms, and so that's one component of our body mass index, which is our typical, not metric, but method of analysis. The other component is your height. So if you wouldn't mind stepping over here, we'll get you measured up next to our very, very secure tape measure. So if you wouldn't mind standing with your back against the wood. Yep. Alright, I can manage that. And we can see in this here, you are 155 centimeters.
I'm not.
Sorry, 175 centimeters. I got my units wrong.
Yeah,
175 centimeters.
that's much better.
Apologies.
I was shrinking way too fast for my liking.
Very, very accurate, as you can see.
Yep.
And so if you want to come over here just at this desk, we'll do some quick calculations and run through the basics of the body mass index and what that means for you. Feel free to take a seat. And so if we're talking about a weight of 61 kilograms. 61.9.
Yep.
And a height of 175. A BMI is taken by dividing your mass by your height in meters squared. So if we go 61.9 divided by 1.75 squared, that's not going to like that. Here we go. 61.9 divided by, let's clear that. I think I've got some existing.
Yeah.
Equals 20.21. Sorry, that took a while. Which is well within a healthy range. If you look here, we would consider that completely normal, underweight being below 18.5 and entering into overweight, obese territory at 24.9 and upwards.
Okay, yeah.
From there, we're going to start on some girth measurements essentially. So your chest, waist, thigh, arm and hip. And so the basis of those measurements are going to occur in the areas as follows. So your chest will be at the widest part, typically right over the bust.
Yeah.
Your waist will be, we're looking for the skinniest point, it'll be right above essentially your hips. Above the bone, it'll be at that that's the landmark at which your waist should be thinnest. Then we look for the widest part of the hips to give us our waist hip ratio.
Yep.
From our thigh, that is going to be taken from where your index finger, or your middle finger, I should say, meets the middle of your thigh. It's a place that we can refer to continually. The middle of your arm is going to be taken halfway between the two processes up on your shoulder and one on your elbow, so it's going to be somewhere in the middle of the bicep. And then from there, I think that's about it for us in terms of that measurements. From there we get a couple more ratios, and again that helps us kind of put a prognosis of sorts on, or give us an idea of your body composition. So if you don't mind, we'll get you to step back into the light where we can see you. And so, starting with this lovely tape here, if you wouldn't mind passing this end around the back yourself. Yep, lovely, and I'll hold this end. I'll take that if you don't mind. So that's the widest area. And we have 91 centimetres. So we'll just lower that down here. If you can pass that around the back again. Thank you. Perfect. We have 76 centimetres. So I'll just note those down before I lose them from mind. And so passing this around your waist again, I'm going to be looking for the widest part. Lovely. And so we find ourselves at 96 centimetres. And now if you wouldn't mind lowering your hands down. Yep, that's it, standing with leg shoulder width apart, so slightly narrower. And I'm just going to take the measurement from this point. There we are. At 52 centimetres. Just note those down. And I'm just going to get your arm, so it's going to be halfway between these two processes. And so if I go essentially here to here, there to there, I get somewhere right about here.
Yeah, careful of my big biceps.
And we have 26 centimetres. I might just do your hips one more time, just to make sure. Normally, we would take an average of the hip. So, essentially we go from the middle, one up, one below. So if you don't mind, I'll quickly do that before we move on. So if you want to pass that around the back. So we try and find the widest area. At that 96. And we're going to go one below. Again, we're at 95, and then we come one above. And we're back at 95, so it's 95.5 from those, or 95 and 2/3 from those two measurements. So if you want to join us back at the table. And so our waist hip ratio here, essentially, it's very similar to what we said. We're looking for a number less than 0.8. Larger than, we're looking for a number less than 0.8. If you're at larger than 0.8, we consider you to be at higher risk of obesity, overweight, and that kind of thing. So if we're going here, 76 divided by 95.66. I'm about to divide again. Uh, 76 divided by 95.66. So 0.79. Which is evidently in our healthy rating, healthy range, I guess I should say. Moving on from there, we're going to progress into our passive or postural analysis. And so, if you wouldn't mind standing up against the wall, facing me, that would be great. And so, I'm going to get you to do something really stupid. You're going to march on the spot as you think of the Tin Man. So, arms out in front, and I just want you to do 10 strides. Perfect. Yeah, you're nice in line with the wall. And so what I'm looking for here is essentially any kind of abnormalities and landmarks. If you wouldn't mind just resting your hands at your side, that would be great. And so for you, short hair's doing me a lot of favours here. Your head seems to be sitting quite level, your shoulders very close to level. There's a slight raise on this one, slightly more hypertrophy, potentially a touch more muscle mass. It could be also the clothing as well, that kind of thing. We know this is what you're comfortable with and that's what we're going to deal with, and I'm going to take that into account. But we'll just move on from that point and see if it comes out in a dynamic analysis to be any kind of issue. Working my way down from there, I'm looking at your elbow gap. There's a slightly larger elbow gap on this side. This arm sitting slightly tighter to your body than that other one, just showing a slight touch of rotation. From your pelvis, if you don't mind, I'm just going to touch either side of your pelvis. I'm looking for two anatomical landmarks, and we're just going to see how level they are. They're on the ASIS, which is the front cranial point of your pelvis. So if you don't mind, we're just looking for bony marks, and they're sitting right about here and here. And looking from there, they are pretty well leveled, which is great to see. We haven't got any kind of lateral, pelvic tilt that would kind of be an indicator of some bigger issues somewhere. Looking further down our body, we're seeing equal amounts of hypertrophy on the legs, and working down to our patellas. They're both sitting equally right here. Your legs, there's no hyperextension from what I can see at this point, or boning internally or externally, so no rotation. Looking at your feet here, I understand it's a cold floor, but I can still see from here that you have relatively equal arches, just allowing for the socks there. They seem there's no distinct high arch or low arch in either foot. They seem quite equal, which is a positive sign. And so moving forward, I'm going to get you to rotate 90 degrees, pick a choice which direction, and I'm going to get you to do 5 marching steps again. Perfect. So if you could just look, directly ahead, that's great. And so starting off, back at the top again, we've got a great level head. It's not protruding too far forward either. If I'm just going to pull back your hair here to see your ear. So we're looking for a plumb line of posture. If we're looking at an ear, it's very slightly forward of our shoulder, but we could draw a line that would bisect the two, just not through the center of both. There's no forward or backward tilt of her head, it's nice and level, and her neck isn't protruding forward, as we would say these days texting neck or computer neck. Working down the body, we're looking at the shoulders. They're sitting, this shoulder on this side anyway is sitting nice and level. It's not pulled in, hunched over. It's not too proud back, it's not protracted unevenly. It follows a nice line. If we look for the plumb line, at least with her posture, down her hip, bisecting the knee and ankle. So a nice straight line through her posture. That's also backed up by a nice kyphotic curve in her thoracic region and a nice lordotic curve in her lumbar spine. Looking down to her pelvis again, we're gonna, if you wouldn't mind, I'm just gonna feel for ASIS and PSIS. And essentially these are two anatomical landmarks that give us an indication of posterior or anterior pelvic tilt, if there is any. And so, if you don't mind, I'm just going to lift this up. So we're sitting right about here and here. And so it is expected the posterior PSIS sits slightly higher than the ASIS, but I would not say that it's too far above, and it's certainly not level. So that would point to a neutral point of the pelvis being in a neutral position, no excessive posterior or anterior tilt. Essentially just the way we want it, which is great to see. And working down the leg slightly further, we're looking at a straight leg, but we're not looking at any hyperextension. We're not seeing, we've still got a curve essentially in the knee joint here. If there was hyperextension, that may be dead flat or bowed out backwards. So we're not seeing that, which is great to see. And she can stand on what would be a nice straight leg, the hip, knee and ankle all bisecting each other quite nicely. Again, we're looking at the arches of the feet. From this angle, again, they appear quite natural. There's no deviation of the foot either. In terms of pigeon toeing or duck footing, in terms of if you want to go by slang terms. And so, with that out of the way, I'm going to get you to rotate 90 degrees again, if you wouldn't mind. And march on the spot for me 5 times. Can you just take a step across to your left? Not to. Halfway between, please. Perfect. Perfect. And so if you wouldn't mind staring just at the wall first, staring straight ahead, that would be great. And so now at this point of view, we're starting back at the top again. We're looking at the head. It's nice and centered. There's no left or right tilt. Looking at the shoulders, again, might have a slight little bit of elevation on this side, but it's very, very minimal. And again, it could be even just due to clothing. We're looking further down the back. We're looking at the scapulae. Can I feel them? Are they winged at all? There's a touch of scapular winging on these sides, just to the fact that I can get my thumb under here a little bit, more so on her right hand side than her left. That might indicate a little bit of a tight chest. In terms of the rotation, the angle and landmarks of the scapulae seem to be in quite a normal position. At this point you can see the outline of both of them, and they do not seem to be protracted or elevated in any abnormal fashion. Working, I guess, further into the middle, we're looking for some scoliosis. So I'm just going to run my finger down your back if that's okay. I'm just going to feel for each vertebrae essentially, and I want to essentially feel for a nice straight line down your back there. So working our way down, there's no real indication of any scoliosis whatsoever there. That is quite centered and straight, which is great to see. Now I'm just going to go back to the PSIS if you don't mind. We're looking for any lateral tilt in that direction, and so in that view, I should say, our posterior view. And so if you don't mind, I'm just about to feel for them right now. There's one there, and another right there. And so they're quite even in their distribution. There's no real tilt to them at all at this point, especially from what I can see. What we'd be concerned with if we could see something in that or that kind of realm, something that would lead us to believe that potentially she had other existing problems at that point in time. Again, we're going to work our way down her back, now into the legs and knees, just looking at both her, essentially, the word for it escapes me at this point, but the rear of her knees, as long as the medial kind of bulbs right here line up, and the inner joint, the back of the joint, is lining up in terms of the creasing and the mobility point, we're all in good stead. And now we're going to work our way slightly lower down. We're going to look for the Achilles tendon. And so the Achilles tendon starts at the heel right here and works its way up to become part of the calf muscle. So what I'm looking for is the fact that these Achilles tendons here are both centered down the back of the foot, which they are here. There's no kind of deviation laterally from these points. Again, we can see that her feet are evenly arched. There's no pronation or supination abnormalities present. Lastly, I'm just going to take a step back and we're going to look at her weight distribution at this point. Is it left? Is it right? And I can't say distinctively that there's any unequal weight distribution. It seems quite centered, and we will, I guess, confirm that with our final rotation, if you wouldn't mind, of 90 degrees. Perfect. 5 marching steps, please. Nice. So with our hands by our sides, just relax, that's nice. And those there, I should mention, have a nice equal sitting. They're not rotated either forward or back. Her elbows are quite sitting well against her body. They're not splayed out and they're not tucked in what would be considered forcibly or uncomfortably. So from here now, I'm just going to find your ear again. We're looking right there. Again, it's almost perfectly with the plumb line, the back of the ear meeting essentially the midline of the shoulder, down through the hip, slightly anterior part of the knee and ankle. Her shoulder here, it's quite similar to the first one, I would say, very slightly anterior rotated. So maybe there's a touch of chest tightness as well as the additional muscle in the trapezius. But following her arm down, it looks quite even. There's no aggressive angles. It all follows a similar line. At this point, I'm looking again at the ASIS and the PSIS. So if you wouldn't mind, I'm just going to ask you to bend your arm at 90 degrees. Perfect. So just going to look for that frontal landmark as well as our one in the rear. So we're looking here and here. Again, a slight bit of elevation in the PSIS over the ASIS, but absolutely not what we wouldn't expect. And so I can absolutely say that that won't be a problem at all for you. Again, I'm just going to quickly check over your spinal curves, both kyphotic and lordotic. In a second, just looking at your weight distribution, it seems quite equal. Again, knees and feet are both, I guess, a clean bill of health, so to speak. Equal arches, a healthy amount of arch, and your knee isn't hyperextending or unable to extend into straight. So if you don't mind, I'm just going to run my fingers down your back just to check your curve. And from here, we can see that she has quite an even and acceptable amount of kyphotic curve in the thoracic region and lordotic curve in her lumbar spine, which is nice to know.
Good.
Perfect. And so from this area, I'm just going to ask you to move into our nice light area over here. Excuse the pooch. But we move on to our dynamic movement pattern.
Yep.
And so I'm going to try my best here. I'm a little bit out of sorts at the moment. But what I'm going to ask you to do is start with the bar over your head, touching your head, and then take your arms to 90 degrees at that point, and then extend the bar overhead. From here, we're going to do a simple squat, and I'm probably going to ask you to repeat it a few times. but I want it to look as much like this as possible. And so I want the bar to remain overhead and as straight as possible. And I'll try and give you any corrective tips if I see anything out of place. Yes, that looks great. If you want to extend the bar over your head and start your squats, I will be with you in just a second. And so what I'm going to start here facing front, I'm going to be looking at your shoulders, your weight distribution as you go down. So feel free to begin. Keep going, please.
Okay.
Yep. Alright, so if we can stop there, you can feel free to put the bar down. It's going to be a little bit of a discussion, so to speak. Starting off, looking front on, you appear to have a little bit of tightness, in the front of your body. So whether it's your chest or it's just a lack of hip flexibility. But when you squat, you lean quite far forward, and it is to balance yourself a little bit, but we are looking for the most upright position that you can maintain at that point. Aside from that, you don't appear to have any kind of abnormalities we would worry about. Your knee, hip and ankle flexion is all quite good. You seem quite well balanced. If you do a couple more, I'm going to look at the posterior and other anterior view. So bar slightly back a bit, over, that's it, and going down. That's already better actually. Maybe it was just my discussion or lack thereof. That's it. You're nice straight back. So nice. Alright, 2 more please. Alright, nice. Nice work. You can put the bar down if you like. Very good. So there's a slight bit of shoulder elevation on that side we already discussed on your left hand side. And so essentially what's happening there, I think you've got a little bit of shoulder tightness in there as your shoulder can't extend as close to your head as you want, and as a result your the region of your trapezius is slightly extended and you have a little bit of scapular rotation.
Which side's that?
On your left hand side.
Yeah, I've just been to the doctor for tightness here, so.
Mm-hmm.
Yeah.
And so that's pretty self-explanatory. In terms of weight distribution, great, nice and centered, and even throughout the whole motion, both from a lateral view, posterior and anterior view. You seem to have quite good weight distribution, as well as your flexibility. And so from there, we're going to get into, the boring stuff, if you like, the food diary and our goal setting, if you don't mind. And so I'm going to leave this one to you so much. We can kind of talk you through it a little bit. Essentially, a quick summary of what we've consumed today. So breakfast, lunch, any snacking, that kind of thing.
Yeah. Breakfast. Breakfast
That's all right. That's our time.
7:30, I guess.
Yep.
Porridge. Amount.
It's a rough estimate. It's okay.
A third of a cup dry is generally what it is.
Not a problem.
Now I have some yogurt with it.
Yep.
2 tablespoons, I guess.
Yep.
What do you mean serving? So I have one of this, but
yep. No, that's fine. It depends on whether you have a pre-portioned meal or you make it yourself.
I didn't have morning tea today.
Oh, that's unfortunate.
Lunch.
Would you normally eat morning tea?
I might have some fruit.
Okay.
And actually, I went for a run at lunch, so I had a late lunch.
Yep.
If you call that lunch, 2:30 to 3, I think it was. Might even been later than that. And I had some Fido Weeks,
Oh, righto.
which is not normally what I have for lunch, but maybe 5 lots of those.
Righto.
With Vegemite.
Would you normally eat something more substantial?
Yeah, normally I'd probably have a toasty.
Okay. Yep.
Oh, yeah, that should go over there. But and I didn't have any, unless you call my lunch afternoon tea.
No, we can negate that.
And I haven't had dinner yet.
Not a
but
problem.
At 7 o'clock.
Yep.
I'm probably going to have some salmon, some veggies.
Yep.
By 5 times.
Nice. And then just to round things out, any dessert or late night snacking, or any alcohol.
Maybe 2 wines.
Okay.
Wine. Probably about 2.
Not a problem.
Do I have to do this for a week or just a day?
No, just a day. And so that's just gives us a rough overview of your dietary habits and that kind of thing. And I understand, like we're discussing it here, it's not necessarily representative of a regular day, but we can take that into account.
Yeah, because there's no fruit in that day, and I would normally have fruit.
Yes.
So.
And as a kind of thing, while we do this for every people, you're not typically the person that we would be concerned with regards to diet. You're maintaining a regular BMI, your waist to hip ratio is fine. You're not obese or underweight. Don't appear to be at risk.
Yeah.
With regard to your waist hip ratio. Lastly, we're just gonna look at a behavior change analysis, so a bit more of the mental side of things. And so it's just about how we're gonna interact with each other and how you're gonna, I guess, attack this this fitness journey that you're going on, the levels of motivation you have, what desires you have, and what kind of gets you up and into this day to day.
Yep.
So if we start here, we kind of want to look at what kind of goals you have for your fitness journey. So from memory, it was a little bit of weight loss in 6 months. So about 10 kilos over 6 months.
Yeah, maybe not quite
quite
that
10?
much. Yeah, no.
Or 5 kilo.
Yeah.
5 kilo. So if we're able to put this in our long-term goal, we can actually backtrack from there and essentially put out stepping stone goals, I guess is the best way to describe it. And so if we just dictate that quickly down here. We can quickly look back, and so if we want to talk about our goals at I say the 3 month mark that would be in, we're looking for, I don't know, what would you look for in 3 months?
Look at, I guess at my age, I'm looking at toning and strength maintenance. So like the weight loss might be there, but it also, I also understand that muscle weighs more than muscle. Yeah. So I'd like probably to have a better shape.
Yeah.
And whether that ends up being kilograms off or not, I
Yeah.
guess. So that's probably,
So you understand the difference between weight loss and fat
Yeah.
loss? Yes.
yeah, so, you know,
Yeah.
I'm
No,
I'm
I guess that.
I'm nearly 60 and I'm looking at how I can do what I want to do
Hmm.
for longer. So
Right.
I'm looking at that, maintaining muscle,
Yep.
like you've said, my posture's good, and
Hmm.
I've had a history of intermittently going in and out of weight training, I guess, and doing stuff. So I sort of need to get back into that and probably not give it up.
Right. So that would
Yeah.
almost be a great short-term goal to
Yeah.
commit and form a habit so much
Yeah.
of going to
Yeah.
the routine.
Yeah.
So if we put that in our short-term, form a gym attendance routine.
Yeah, because I'll do it, and I'll do it for so long, or tick off this is what you're doing for so many weeks, and then tick, and then I miss a day or 2 or 3, and
Yeah.
suddenly I'm gone again.
Yeah.
Yeah.
And so with that in mind, would you say the main behaviour change we're looking for is a increased commitment to the training plan, or an increasing commitment to a long-term goal?
Yeah, well, I'm good at the outdoorsy ones.
Yeah.
But yeah, the indoorsy ones. So going to the gym, I'd much rather, if I had a choice, and go, are you going to go to the gym or go for a walk or a run? I'm going to go for a walk or a run. So
Yeah.
I need to commit a bit more to, the strength side of things.
Yeah.
I think.
Not a problem. Yeah, so I've just said that as forming a strength training commitment.
Okay.
Great. And I might just leave this to you to fill out a little bit more, because it's a bit more on how you perceive things. It's a series of 12 questions, kind of regarding how you feel at this point regarding embarking on this journey and the training associated.
Yeah. Well, I'm enthusiastic now. It's just I'm not sure how I'll be in 4 weeks.
Yeah,
time.
and that's partly my job to make
So,
sure
yeah.
that things are still engaging for you and
Yeah.
keeping you interested.
No, well, I'm going to say, well, definitely, or really nearly definitely, I want to make this change, yes. I could make this change.
So you think you're capable of making this change? Does it seem like an impossibility or something that is completely achievable to you?
Oh, yeah, no, well, I should be able to.
Yep.
There are very good reasons for me to.
Yep.
I have to, I don't. I have to? No, I don't have. Well, I don't know. I don't have to, so. Well, I'm not quite sure what that's meant to. I don't
It's
have
more
to.
so, are you doing this
I'm
out
doing
of
this
choice
for
or
me.
necessity?
Yeah, I'm doing
Is
this
it-
for me,
Mm.
so I don't have to. So do I have
Yeah.
to? Do I put not here for that?
Yeah, sure. Because it kind of signifies that you're
I
doing
don't
this
have
out of
to,
the
but I'm doing it for-
enjoyment and the own desire, not the fact that it's
Yeah.
a health
Yeah.
necessity for you.
A doctor hasn't told me to do it.
Yeah.
I want to do it,
Yeah.
and then so I want to do it, which I just said out loud. So that is a 10.
Perfect.
I intend to make this change. Yeah, I do. I'm trying to make this change. Yeah, they're interesting, aren't
Yeah,
they?
it's-
And I agree with that I'm putting them down.
Yep.
I'm trying to make this change. I intend to make this. Yes, I do.
Yep.
But there's still that little bit of, I hope to make this
Uncertainty, yeah.
change. Absolutely hope to. I can make this change. I'm sure I can. It's important to, I don't know what that, I think it is important to me.
Yeah, it's kind of, are you
I
motivated?
need to make it. No, I don't need to make it. It's important to me.
Yep.
I'm going to make this change. Well, this thing's talking me into it. Yes, I am. I am doing things to make. Well, I am. I'm here.
Yeah.
So yeah.
Absolutely. I think that's the.
There's so many questions.
It is, and it's not only does it tackle the mindset, but it's a way for me to kind of see what motivates you. So if we want to look here, it's important for me to make this change versus I need to, or I have to. So essentially, important means that you're internally motivated. It's important to you to do this.
Yeah.
Do you need to? No, you don't, but you also don't have external motivators telling you that you need to, which is a component of I have to make this change. Say a doctor has told you that you have to make a change, or a family friend has said you need to make a change. No, it's more so that it's important to you to make this change, but you recognise it's not a necessity.
Yeah, I want to do it because I want to keep doing what I'm doing now. And to keep doing what I'm doing now whilst getting older, I'm going to have to work on it rather than figure it will keep happening.
Perfect. And the last little things I'm going to get you to are enter, obviously your name, your age, your gender, and your date of birth.
Oh.
I know. I notice you've also got a nice sport watch there. Does that tell you your resting heart rate?
Yep.
Perfect.
You've obviously spoken about it because it's going up.
Well, yeah, the first number I saw there was 53, so I'm happy to put that there as well because that's quite a healthy heart rate to have.
It's not my resting, it tells me at night it's somewhere in the 40s.
Wow. Well, then we'll put that down then if that's your heart rate.
Let's go for 45.
Not a problem.
Sometimes it goes to 39, so I think I'm dying then, but...
That would raise some eyebrows for sure. But yes, that is the extent of tonight's screening. Thank you for coming in, and we hope to see you in the future.
I will be here. Thank you very much.
Thank you.